Hi, everyone. I'm Jim Falk, President of the World Affairs Council of Dallas-Fort Worth, and thank you so much for joining today's program, which the World Affairs Council is very proud to host as part of the global recognition of Gay Pride, which of course takes place every June to commemorate the Stonewall riots or uprising, which served as such an important catalyst to launch gay rights movements, not just in the United States, but across the world. Today's panel brings together global LGBTQ plus leaders to discuss the impact of COVID-19 on the gay community and how policymakers are adjusting their policies to help protect vulnerable groups in our society. Want to particularly thank my good friend Rachel McCormick, who is the Consul General of the Consulate General of Canada. She brought this program to us as really one of the priorities of her government. And as always, I also want to recognize Bob Sadowake, who provided terrific guidance and support on this program, as well as to me on other similar type of programs. And Texas Instruments. Texas Instruments is a terrific supporter of the World Affairs Council, as well as many organizations that are supportive of the LGBTQ community. So thank you, Texas Instruments. I think most of you by now are well familiar with the Zoom format, but if you wish to ask a question, just go ahead and type it into the Q&A box, and we'll get to just as many as we can throughout this afternoon's conversation. So with that, Rachel, I look forward to sitting back and listening to your conversation. Thank you.
Hello, everybody. Happy Pride, and thank you, Jim, and thank you to the World Affairs Council here for Dallas-Fort Worth for all your work on this important event. As Canada's chief representative here to the South Central United States, I'm really honored to be a part of this important and timely panel. You have many experts here to speak to you about really important aspects of the current crisis and its intersections with the LGBTQ community. My job really is to just kick it off with a little bit of an intro about what's been happening in Canada in terms of our work with LGBTQ communities. I'm very thankful to organizations that are advocating, like Egale, the Resource Center, and ILGA, and they're helping advance progress for people to have a safe space, a common voice, and to fight against intolerance. At the end of it all, I guess if there's one message I want to leave you with, is that the Government of Canada affirms that human rights principles are universal and indivisible, and that no one should be subjected to discrimination or violence because of their sexual orientation, gender identity or expression, or sex characteristics. I did want to take a few moments to discuss some of the Canadian efforts, and as well as our ongoing work at home and abroad. We have taken many important steps towards promoting and protecting the human rights of LGBTI persons. This progress has happened both through court decisions and actions by governments since the late 1960s. In the mid-1990s, our Human Rights Act was amended to prohibit discrimination based on sexual orientation. In 1996, protections were provided with respect to housing and employment. And in 2005, we affirmed marriage equality in law. But the effort continues now, and we recognize that there's more to do. It was in 2017 that we passed legislation to amend the Canadian Human Rights Act to increase statutory protections for transgender and other gender diverse persons. Our federal law now explicitly prohibits any discrimination, hate propaganda, or hate crime against Canadians that is based on their gender identity or expression. In that same year, our Prime Minister Justin Trudeau apologized for past federal legislation, policies, and practices that facilitated systemic discrimination against Canadians based on their sexual orientation, gender identity, or gender expression. We have established what's called the LGBTQ2 Secretariat within the Privy Council Office, which is the center of our government, and they support our cabinet and also our Prime Minister. It's kind of like the White House here in the United States. And they're there to help integrate LGBTI considerations into the everyday work of the Government of Canada. We know that there's lots more to do other than just within legislation. We have to think about this in terms of our programs and our policy. And one of the tools we're using is Gender-Based Analysis Plus. It helps us consider how intersecting identity factors may impact the effectiveness of our policies and our programs. At the international level, promotion and protection of human rights for LGBTI persons is a foreign policy priority for us. We are committed to building global alliances that are necessary for combating intolerance against LGBTI individuals as well as communities, and to affirm that human rights principles are universal. We regularly make our voice heard on LGBTI rights and engage in efforts to assist LGBTI persons who are victims of violence and discrimination. Last year, we announced $30 million of dedicated funding over 5 years to advance human rights and socioeconomic outcomes for LGBTI people in developing countries. And we're working with core groups of member states at the United Nations, as well as the Organization of American States. From 2017 to 2019, we chaired the Equal Rights Coalition.
All right, wonderful. So we're still navigating, as we're navigating the pandemic, we're also navigating the new technology and digital communications to keep the conversation going. So thank you everyone for joining us today. And a particular thank you again to the World Affairs Council, Dallas-Fort Worth, as well as our 3 panelists. So we're very lucky today to be able to have 3 leading experts and again, leading advocates on LGBTQ rights, which are human rights. And I think that's something we can all agree on. So it gives me great pleasure to introduce our first panelist, which is Helen Kennedy, coming to us straight from Canada. Helen is the Executive Director of Egale Canada, which is the largest LGBTQ organization in Canada. Helen brings more than 22 years of advocacy and political experience to the organization. Thanks to Helen's guidance, the organization has actually started and filled a much needed gap in terms of establishing Canada's first LGBTQ homeless shelter. So that's something that again has been numerous years, but thanks to her guidance, we were able to actually address that much needed issue. And again, thanks to her expertise, she's been called upon by multiple international organizations, including the Pentagon, for some assistance on the Don't Act, Don't Tell policy, as well as consulting with the Pope and senior officials at the Vatican. So without greater delay, I'd like to introduce and pass over the platform to Helen Kennedy from Egale Canada.
Yeah, thanks, Noella. And coming to you, not straight from Canada, but gaily from Canada, or clearly from Canada, as we like to say. I'm in Toronto, in Ontario, and as Noella has expressed, I'm the Executive Director of Canada's LGBTQI2S Human Rights Organization. And the 2S stands for our Indigenous members, Two-Spirit. It's a term that is indicative to North America and Canada in particular. But if you're wondering all of the letters of the acronym, I will hint and give you a hint on the 2S. It's for our Indigenous folks. I want to thank our Consul General. It is a real pleasure to be on the same platform as some amazing allies to our work. In Canada, we're incredibly fortunate to have a government currently that is a strong ally. It hasn't always been the case. And whilst there is a lot more work to do, we're very grateful for the relationship that we currently have with our present government. And kudos to the US and the recent Supreme Court decision. Absolutely thrilled to see the decision coming out on Monday. In spite of the fact that it is still hard to believe that we have to go to the Supreme Court to get our rights to actually hold a job without discrimination. But Egale has been immersed and involved in 13 Supreme Court cases over the course of its history. And I'm happy to say that we have a 100% success rate in that in that sphere. So we're really lucky. But congratulations to everybody in the US. The world was watching, and it's great to see the decision coming out in our favor. So COVID in particular has been particularly hard on our communities, and it's something that Egale recognized right out the gate when we were all forced to work remotely and live in isolation. Something that we know from our history is that our communities suffer tremendously around homelessness. We have high rates of youth, queer youth homeless populations in our cities, access to health care, mental health issues, chronic disease. But what we didn't really have a handle on was the extent of the impact of COVID on our community. So Egale partnered with a research firm here in Canada called Innovative Research to conduct a study and a survey, an online survey. We released it in March. It ran from March 24th to 29th. And the results were really quite staggering. We had a really good representation in terms of the demographics across the country, male, female. We had non-binary, trans folk respond to the survey as well. And it was quite shocking, the contrast between Canada's LGBTQI2S communities and the broader Canadian population. And so some of the findings of the study, the crisis has affected the employment security, for example, for the majority of LGBTQI2S households. An estimated half of Canada's LGBTQI2S households have faced layoffs or reduced employment as a result of the pandemic, compared to 39% of the overall Canadian population. So that was really something that we had to grapple with. And 12% of fewer LGBTQI2S respondents feel confident about their current situation and their ability to get employment following the pandemic, which was also adds to people's mental health, their security, their lack of security. We've reported greater impacts in terms of our physical and mental health and our overall quality of life. 42% of our community reported significant impacts on their mental health, compared to 30% of the non-LGBTQ I2S community. And the significant impact on our mental health over the course of 2 months, when you look at where we were in March compared to where people thought that they were going to be 2 months into the pandemic, 58% of our community felt that they were going to be worse off in 2 months compared to 42% of non-LGBT Canadians. So these are all very, very startling findings, and our research is online. It's the first of its kind in Canada to give a glimpse of the unique vulnerabilities and challenges that face our LGBTQI2S communities in this crisis. And obviously, you know, some of the things that we need to look at now is applying some of this research to some of the policy initiatives that our government is currently undertaking in order to address the impacts of COVID-19 on some of our most marginalized members of our society. So the work for us now is really just beginning. The extent of the research is tells a very particular story around how disproportionately members of the LGBTQI2S community in Canada is impacted by COVID. And so it's our job as Canada's LGBTQI2S human rights organization to make sure that the government applies a full intersectional lens on on some of the measures that they're implementing to help assist and rectify and apply funding to alleviate some of the impact that it's having on our communities. So I'm really grateful to the current government in that some of the grants and the funding that they have made available to our communities to implement some projects around accessing healthcare and programs for our senior populations, for example. We do know that our LGBTQI2S seniors are feeling more isolated. Many have already lived through similar crises in the 80s and the HIV and AIDS crisis. And so, you know, we're looking at creative ways to engage our communities over the course of this pandemic and beyond, because I think none of us is so naive to believe that this is going to end quickly. And I do believe that we are going to be returning to a different world in how we do our advocacy over the course of the next 3 to 6 months and beyond. So those are just some of the things that have occurred in Canada since the pandemic started here in our country, and some of the impacts that we have uncovered for our communities. So I'm happy to answer questions, but I'm really looking forward to hearing from Cece and Andre. And so we can further the conversation and hopefully engage in lots of questions in the online chat and really get a strong dialogue going on this topic. So thanks, Noella.
Wonderful. Thank you so much, Helen. Really appreciate it. So we'll move on to our next panelist, and then we'll take questions at the end, as mentioned by Helen. So our next panelist is Cece Cox. I feel she's sort of a superstar in the Dallas metro area. So everybody speak to say, have you met Cece Cox? So, and yes, indeed we have, and very happy to have her here today. So Cece Cox is the Chief Executive Officer of the Resource Center here in Dallas, which is one of the largest LGBTQ community centers in the United States. Again, the center, as many of you know, provides health services to individuals affected by HIV/AIDS and serves more than 60,000 people per year. Cece's exemplary career spans over 30 years. Again, a very, very strong ally to the LGBTQ community. And prior to her appointment as Chief Executive Officer, she had the pleasure of assuming several roles. And prior to that, a very impressive career as well, with a bachelor in journalism from Northwest University, and again, a proud alumni from SMU's Dedman School of Law. So without further ado, Cece Cox.
Thank you, Noella. It's so nice to be with familiar faces, and I see in the chat room there, we've got a lot of attendees, so great to be with everybody here. Many of us were together at the LGBTQ Global Symposium that the World Affairs Council hosted at SMU in February. So that was one of the last public events, as I recall. It seems like a lifetime ago. So nice to be together again. I'm going to set my alarm here real quickly so that I don't eat up too much of the time. And as Helen was talking, there we go. I'm the short one on the left. As Helen was talking, there were many similarities that arose in terms of how COVID has impacted the LGBTQ community here in the United States. And of course, there are contrasts as well. While I am thrilled and inspired by the support that the Canadian community has from your government, that is clearly a contrast in what is happening in the United States today, sadly and regretfully. And just last week, the Trump administration actually rolled back protections in regard to healthcare for LGBTQ people. So it will be even harder for our community to access healthcare at a time in which we're facing a global pandemic. And as much as we celebrate the Supreme Court case this week that was announced, the decisions that came out, those are limited to employment at the current time. Now, we know that that case might be leveraged later as influential and impacting other rules and regulations in other areas, such as public accommodations, healthcare, housing. But right now, those were employment law cases, and the decision is about protections in the workplace. Also limited to employers who have 15 and more employees. So if you're working for a small place, you do not benefit from those protections. So COVID has, in my opinion, served as horrible as it is, and it has caused great destruction and loss of life. It's also a magnifier and a catalyst. It's like a magnifying glass. It is allowing us to see the disparities that have existed in our society around healthcare and all kinds of other institutions, and to a point at which I think we can no longer turn our backs on it, or at least there's an opportunity for more people to be educated, because things have become so obvious as to so many discrepancies. So I am hopeful that organizations like Resource Center and others who are focused on health and access to health and civil rights and equality and justice can band together and use this, what is really a disruptor, as something that can become a unifier and create new ways to do things. COVID's not happening in a vacuum. And what I mean by that is some of the discrepancies that are already impacting the LGBTQ community are now impacting all communities. And so you have these overlays of existing disparities with COVID on top. And a couple of points, I don't want to get too bogged down in too much data, but a couple of data points that I wanted to make. 17% of LGBTQ adults have no health insurance coverage. and 32% of transgender people of color have no health insurance. So there will be gaps in testing and treatment in regards to COVID for an already at-risk community. Some other facts and statistics are that 20% of LGBTQ people had indicated that they did not see a doctor when they needed to because they couldn't afford it. And I project that the virus is only going to make this worse. Number one, people are being thrown out of employment, and so their income is even less than it would be already. And number two, we already saw one thing happen, and with resurgence of cases, another thing could happen in that medical providers might not be able to see people as easily and readily on the same schedule that they were. So many of our healthcare resources are being dedicated to acute care. And, you know, if you were scheduled for some kind of like an orthopedic procedure, for example, right before the hospital shut down and said they wouldn't be doing those sorts of treatments, you know, you weren't able to get that sort of care. Given the uptick in the numbers, we could be facing that situation again. Just time will tell. Finding culturally competent care for LGBTQ folks is a struggle for many of us. In Dallas, we enjoy the luxury of living in a large city where it is easier to find such care than in some other parts of the country, but it's still not easy. And a lot of medical providers are not familiar or experienced with serving the LGBTQ community, and this puts our transgender brothers and sisters at particular vulnerabilities where it's even harder for them to find care. And we have seen providers such as Samaritan's Purse mobilized to treat COVID patients, even in places like New York City. But with the reality I just laid out on top of the rollbacks for access to care last week announced by the Trump administration, we're faced with a pretty tough marketplace and access for care. Also, many in the LGBTQ community, because of where they are employed and the types of jobs that they are in, are facing an added vulnerability in light of COVID. Of the estimated 14 million LGBTQ Americans, 5 million of them, so that's roughly 40%, work in jobs that are more likely to be impacted, such as restaurants, food service, hospitals, education, and retail. And this is in comparison to 22% for non-LGBTQ people, just to give you some context there. As Helen mentioned, youth and seniors are often at an increased risk as well in our communities. And now we have many youth who are not in their regular routines and able to go to school. And so they are at home in many instances, and their home might not be a friendly environment. They may be living with family members who are hostile to their sexual orientation or their gender identity and gender expression. And that is creating potentially opportunities for physical violence, as well as mental abuse or harassment, and those ways in which people don't feel safe. Also, similarly, as Helen mentioned, when it comes to the senior population, we know that isolation is a challenge and an issue that population faces. At Resource Center, we have adapted our programs to go virtual, and people are being connected together online, but that's not a panacea either. Not everyone is comfortable with online technology, nor do they always have access to it. And again, to use an example of a youth, they may not be able to find a quiet or a safe place in which they can have a conversation with a group of other peers or folks that are supportive of them. So technology is great, and it's helping some, and even allows us to connect with some people in ways that we couldn't before. If they couldn't physically come to our facilities, now we can connect, but it's also not available for everybody in the same way. I know that I need to leave time for the other panelists, so those are some of the examples that the ways in which COVID is impacting the community. I could talk more if people have specific questions later, but I will leave it at that so that we have time to get through other folks and other questions.
Thank you, Cece. Really appreciate it. Thank you very much. All right, so we move on to our third panelist, which is André Duplessis, which is Executive Director of Alga, Prior to his appointment, Andre had an extensive career on advocacy with the United Nations, assisting on LGBTQ organizations from around the world. He led a successful campaign to create a position at the UN of a UN independent expert on sexual orientation and gender identity. He is a human rights lawyer by profession, with experience in corporate financial litigation, both in London and in China. So over to you. Thank you very much for joining us, Andre. We'll pass the floor to you.
Thank you very much, Noella. And then at the outset, just let me say thank you to the World Affairs Council and to the Consul General of Canada for hosting this event and for inviting me to join and to speak today. And I'm sorry that we missed the beginning of your introduction, Rachel. I know that you dropped out there. Maybe we'll hear from you later. But I wanted to say it's great, as Helen picked up on, to be able to be in a space where we have governments speaking out strongly in favor of queer people. I think if we were having this, any meeting like this 20 years ago, 30 years ago, we might find one government if we were lucky, if that. And I think just to recognize globally the huge shift that we've seen. That's not to say that governments are perfect, far from it. I know Helen's got her work cut out still with Canada, but just to say, just to acknowledge that. ILGA is the International LGBTI Association. In case you don't know who we are the World Federation, which means that we are a group of 1,000, a small group of 1,600 LGBTI organizations around the world. And we are what we call queer democracy in action. We are a group of activists who elect a board, who direct global LGBTI agendas and try and hold a fantastically queer, complicated and amazing movement together across 6 continents and endless letters in that alphabet soup. I know it's great to have Helen here. Helen was actually the Co-Secretary General of ILGA World until recently, and has been one of the incredible activists both on the ground but also working internationally. And I think that just gives a bit of a flavor as to who we are and what I hope to be able to bring in a few short minutes today, which is to say, I'm hearing what is happening in Canada, I'm hearing what is happening in the US, and oh my goodness, this is really a global moment. So yes, it's obviously a truly global pandemic. We know that. It is taking place at the planet at approximately the same time, but actually not exactly at the same time. I think we're seeing the pandemic rolling out in different continents at different rates, and certainly populations are experiencing this entirely differently. Some of us are behind computer laptops and on endless Zoom calls and isolating homes, and other people are sleeping on the streets, or are still having to go to work in key line industries, or are being laid off with absolutely no income at all. And I think I will talk about that because it's a global solidarity moment, and yet a very complicated global solidarity moment where in fact, what we see is that the divide that was there already, and I'm so grateful that Cece and Helen have picked up on this already, is that the divide that was there, the marginalized before are even more than what marginalized in this moment. And LGBTI persons are part of that. We're not the only people who are being marginalized in this pandemic, but we are. I think the other thing to say is that while we're grateful for this great moment of solidarity and we're seeing incredible coming together and some very positive things, we're also seeing some responses by governments, in particular in some places, as being very damaging. And so some of what I will say will touch on that. But yes, just to hold on to a bit of that hopefulness as well, I think we are seeing that COVID-19 times are a moment when the world is saying enough is enough. And some of that I think is being seen in the Black Lives Matter movement at the moment. There is much longer history around that, but there's a reason why protests like that are happening at this moment. And I really hope we as a movement, but I do believe that government and policymakers and decision makers around the world should be using this particular moment to say what needs to change, how can things be different. As a global organization, what we've done is to try and bring a little bit of the story of what's happening to queer people around the world. I'll just give a few examples of what we're hearing. Some of it will be the same as is happening in North America. We know that access to health by LGBTI persons, people have been facing stigma, discrimination, pathologization, well before the pandemic arose, and during the pandemic moment when healthcare providers are themselves anxious, or people are anxious. We're seeing people are fearful to go to seek care. Particularly, we're seeing trans people. Gender affirming medical care is sometimes being declared to be non-urgent. And some people are saying, well, this is just a cosmetic thing, which we can deal with when times are normal, but stay away. But actually, as we know, of course, delays, interruptions in therapies, in surgeries, that can actually lead to infections, chronic pain, hormone imbalances. And so we're seeing quite horrific levels of non-access to healthcare for people around the world. I would say we've seen that, particularly we've heard some stories of trans women in the Caribbean who've just been literally unable to get access to treatments at all. I want to talk a little bit about what happens in the scapegoating of LGBTI persons as well. I'm always very proud that we as LGBTI people seem to be able to cause earthquakes, we seem to be able to cause typhoons, we seem to be able to cause any number of things, because all these number of religious leaders and sometimes politicians will come up and we get blamed for a lot. It is God's vengeance on this planet. And that just breaks my heart, if it weren't actually a little bit funny at the same time. And I think what we are seeing is, if it was just isolated incidents, we could brush it away. But it's not isolated. We've seen it in South Korea. We've seen it in Turkey. We've seen it in North America. We've seen it in Central America. We've seen it in Africa. It has been people right in central ministers of government in some countries who have actually been saying this. And I think what we see is, therefore, the fear that somehow we as queer people bring into to the mainstream population is just completely exacerbated at these points, and it leads to a level of hysteria, and it leads to the violence which can then be perpetrated maybe by the government in question, but actually in some ways more likely by people in the local community who feel that they have permission now to go out and wreak vengeance or take action against people. That is something that we find absolutely horrifying. Thirdly, it's been touched on already, I mean, access to housing, to water, to sanitation. We know that, you know, for some of us, like I've mentioned already, shutdown has been sort of okay. It's meant a lot of time watching Netflix perhaps, but actually for so many people, youth have been forced into homes with homophobic relatives, forced to stay with them for months. With levels of domestic violence, we're seeing that, again, that is across the world, and particularly in places where people are living in difficult housing conditions already. We've talked, of course, about vulnerable LGBTI elders, and of course, LGBTI youth who have extraordinarily high levels of homelessness due to already existing homophobia and transphobia in their communities. We've also seen a targeting even of those places which are providing shelter. In Uganda, we saw an LGBTI shelter for youth was targeted. No other shelters were targeted by the government forces, by the police, but actually they went and they raided an LGBTI shelter and said, oh, well, this is an illicit gathering of people against quarantine rules, specifically using quarantine rules to then actually target a group of people. That kind of thing we see, and that's what I'm talking about when I say that COVID-19 protection measures can then be turned against queer people. I'll start to wrap up a little bit, but the right to work, the impacts on our livelihood. We are working across the world, queer people are working in quite often in the informal sector due to huge, inability to be able to access the formal market. That sector has been completely ravaged, particularly the service sector in so many countries, hotels, cleaning, all this area. And we are disproportionately affected in that, not least sex workers as well, who've had absolute inability, not only during these times, but also we're expecting for months and potentially years to come, severe restrictions on them. Finally, I'll talk about civic space restrictions. Happy Pride Month, everybody. Please put up your hand if you're actually going to go to a physical Pride. I don't think anybody is. In some ways, parades have some ways become a happy parade, right, where we celebrate. But let's not remember that They started and they continue to be places where we march for our rights, because we are not listened to we're not listened to in government spaces. We're not listened to by the public. So we have to stand up. We have to be there on the streets. And we see that in this moment in the US at the moment. Black Lives Matter have come out onto the streets. They might be restricted, but we have to be there, because if we are not seen, we will not be heard. So to actually have this shutdown happening during a Pride Month when we should be marching for our rights, I think is particularly powerful. And so we are losing that capacity to actually, and how do we actually persuade people in these times when we cannot gather? There will be plenty more that I could say. I will just say that this is exactly what we at ILGA are doing, is taking this message. We are taking it to the United Nations. We are taking it to governments. I know and be grateful that the Canadian government will continue to listen and to use their political influence in the United Nations and beyond, to make sure that we are not forgotten in the multiple government actions that are taking place in response to this COVID-19 pandemic, because we cannot lose this moment, and we cannot be left behind in this moment globally, because that is what happens all the time. It happens all the time. We are the first to be pushed to the corner and decide. Thank you.
Thank you very much, Andre. Appreciate that. I think at this point, I mean, in terms of the COVID pandemic and also what's going on in the other movement in terms of Black Lives Matter, we really find ourselves at a very interesting juncture right now in terms of US politics. I think what we're hearing very clearly is that basically human rights principles are universal and undivisible. So thank you very much. We'll proceed with some questions. All the topics were really, really interesting. I've taken copious amounts of notes. In terms of questions, both Cece and Helen touched upon the challenge of isolation during this pandemic, particularly in terms of mental health for seniors, which again, many of these also endured the HIV crisis. Helen, you had mentioned that Egale Canada is looking at creative ways to engage communities. Could you speak a little bit about that, and in terms of sharing some best practices, if there's anything that maybe we can share with the others online?
Sure. So yeah, actually, in terms of the seniors piece, Egale works very closely with a great organization in the US called Sage USA. And they do some really creative work for LGBTQI2S older persons. And so one of the things that Egale is looking to do, and looking for ILGA to do actually, is to establish a working committee, a global working committee on LGBTI older persons, because the older populations they tend not to be discussed at the same rate or levels of interest as, you know, our youth populations. And really, when you look in terms of Canada, every decade of our older person's life at this point, since partial decriminalization in 1969, every single decade, that queer person has had to fight for some right just to exist, right? And whether it was decriminalization in 1969, right through being included in the charter, right through to having trans rights included in the charter and the criminal code, then marriage, every stage of their life, they've had to fight for something. And now even going into long-term care facilities, for example, we and the research that we have done indicate that our seniors are now having to go back into the closet when they go into long-term care facilities. So through the work that we're doing with SAGE in the US and hopefully internationally through ILGA in the coming months, we will be able to address some of these issues of elder care in our long-term care facilities, because we know that our senior populations are being discriminated against in long-term care homes. Their families aren't being allowed to come in. This is, you know, even before the pandemic, so it's heightened now. And we know that seniors' homes around the world are a hotbed for the pandemic, and high rates of COVID cases and a high rate of death in our long-term care homes. So we have to do more, we have to be vigilant, and we have to be deliberate around how we address these issues. And one of the things that we're doing at Egale is, yes, we're doing more research, but we're also looking at creative ways to get our seniors connected, to get them out of isolation, get them, you know, whether it's food or conversations with other networks in their communities, and just generally trying to connect to see how we can address in this time of the pandemic the concerns of our older populations. So that's just some of the work that we're doing, but certainly it's an area that needs to be talked about more, and it needs to be highlighted. Like it's kind of, nobody in our queer community wants to get old. We're very conscious of, you know, of our young, youthful, healthy bodies, and, you know, and who isn't? But guess what, folks? It's ahead of all of us, and we need to do a lot more to care for our older populations. So I don't know if Cece works with SAGE in the US. I would assume that they do, but SAGE US is a really strong organization, does some great work in this area.
I'm a big fan of SAGE, and they have provided really important resources to Resource Center, particularly around a new project that we have, which is the building and development of a affordable housing that will be LGBTQ affirming for seniors. We have property under contract and a development partner, and we hope to be able to break ground on that next year. And SAGE has staff that have provided us with resources and experience, and I've toured one of their facilities in New York. That's the new housing one in the Bronx, in Brooklyn, I'm sorry. They have another one in the Bronx that I think is about to open, and other resources as well over the years. But yeah, for anyone, for folks who are listening and wanting resources, SAGE is almost unlimited in what they have on their website and what they can provide.
Okay, great, thank you. I'd like to turn our attention a little bit to the great news from this week, the US Supreme Court decision, which again, great news on many levels. So again, Cece touched upon the implications in the United States. Andre, maybe I'll turn this question to you. What do you think will be the implications at the global level?
I was on mute as usual. Yeah, no, well, great news. Fantastic news. I think we all around the world put out not just a little cheer, a pretty big cheer. I think these are difficult times in many, many ways, and good news coming from the United States is particularly hard to find these days. So yes, it's fantastic and it's inspiring. I think there's a message in that I think some of some people were nervous that a conservative-leaning Supreme Court was going to come out a different direction. I think there's something that we can maybe learn from the rest of the world, that let's not give up. If a bench looks a little bit difficult, there are still ways that things can happen. I think what I'd also say is welcome USA to the 77 countries who are ahead of you in the world. And of course you can expect Sweden and Norway and probably Canada to be ahead of you. You probably will be surprised to hear that Mongolia, Angola, Cuba, the Ukraine are also well ahead of the United States on this level. So I think it's actually a sobering reminder that sometimes we can get very comfortable as to where we might be. Please do not get too comfortable. We need to be marching for our rights across this planet. I think the other interesting thing about this case was one very strong thing was it placed trans equality alongside LGBT equality. And we know that our wonderfully complicated alphabet soup. I think it was a great decision to have those two both protected in the same judgment. Although they're very distinct issues, they are deeply linked at their core in why we get discriminated against. It's because we, as queer people, defy gender norms. And I think that cements trans equality. We are ready for the backlash. You will face a backlash in the US, I'm sure, or we will face it everywhere. We're ready for that. I'm not quite sure what format it's going to take, but let's see. But yeah, we're very excited as well. Thank you.
Thank you.
Noella, may I add something to Andre's comments?
Absolutely.
in the continuation that is our movement for LGBTQ equality and civil rights, we need to next push for the Equality Act, because this case is monumental, but it is limited in what it provides, and the Equality Act would be more of an equalizer, such that it would be a piece of legislation that would impact every single state in the United States and extend well beyond just the walls of employment environment. And also need to continue to be mindful, as we see what's happening today, that within populations, within the LGBTQ population, people of color are disproportionately impacted, and continue to do things that are providing the best outcomes for the most people.
Okay. And to that point, Cece, I mean, you mentioned earlier, it is limited, the ruling is limited to employment. So we understand there's a lot more work that policymakers can do. So what would you advise policymakers? What can they possibly do to address the disproportionate impact on LGBTQ people in the United States?
Well, those areas that aren't covered by the ruling this week, such as housing, healthcare access, public accommodations, states can pass inclusive laws around that. And I live in Texas, and we don't have inclusive policies. We do not have employment protections in the state of Texas. So our legislature goes back into session in January, and policymakers should be looking at things like that, which I know our statewide equality group, Equality Texas, is along with Resource Center and other collaborative organizations that work together on such issues, are planning for the next session. Again, Congress could do it nationwide through the Equality Act. And, you know, we need to continually be thinking about healthcare as a human right and not something that can only be accessed if you have enough money, or you live in the right place, or you're lucky to find the one doctor who's competent in your area.
Okay, great. So we've received a few questions from the panelists, from our audience, 4 panelists. So one in particular, so we don't have a crystal ball right now, and the COVID pandemic seems to be raging on. Where do you think we'll be in a few months? And what do you think that would look like in terms of the impact on minority communities and the LGBTQ community, not only in the United States? We'll open this up to all 3 panelists in the United States and Canada, and both internationally.
I do not have a crystal ball, and there's already so many things about COVID that we don't know. The science is developing so quickly. However, I am very concerned about the uptick in cases, and we have seen what's happened with restrictions lifted in all sorts of environments, including Texas. We had 306 deaths yesterday in Dallas County. I'm sorry, 306 new cases. Didn't mean to misrepresent. But that's a high number. It's much higher than it was a month ago. And you all have probably seen the same news stories from other places across the country that I have, where the numbers are not good. Also, this is a virus. I mean, let's just look at it as science. Virus is not going to go away until there is a vaccine. And it's one of the most important things we can do, or continue to wear our masks. And, you know, people are having arguments around that. So I think that, unfortunately, because we do need to be together and contact as human beings, but I think we're going to have to continue to be creative about, and thoughtful and mindful and health oriented about not exposing ourselves and others to this very contagious disease. And therefore, we'll need to continue social distancing. We'll need to continue to provide services in ways that are online or through the phone. And it is hard. I'm an extrovert, and this lack of being able to engage with people that I normally get to engage with has become really more challenging. A colleague sent me an article yesterday that said there's 3 phases of this potentially, and we're in the regression phase. Well, first we had to respond quickly and be creative and come up with ways to do it. Now it just feels like hell. And that's going to last for a while, and then we'll probably, you know, get our mojo back a little bit, and things will become easier and maybe more sustainable. That's what I'm hoping for anyway.
Yeah,
Great.
just jump in. I mean, exactly what Cece says. I think the Egale has launched just this week phase 2 of the survey. We're going back out to see what the impact has been since the initial survey in March, to see where we are with respect to the impact on mental health. I mean, we know what the impact is on employment already. So we'll be releasing the results of the second phase of that survey next week. And, you know, our reality is that the discrimination and the violence still continues to be perpetrated against our communities. And so as community activists, we need to continue the work, and we need to be more creative in terms of how we do it, and how we engage with our governments, how we engage with the institutions like the UN and the OAS has become more important now than ever, because as Andre said, we need to be seen, because if we're not seen, you know, if we're not invited to dinner, we're on the menu. And I think that we have to be in the space. And, you know, just to speak to Cece being an extrovert, I'm telling you, this isolation is a lesbian's dream. I mean, we cocoon, we don't go out, we socialize, you know, with dinner parties. So being stuck indoors for the last 3 months has been heaven for me. So I'm a total introvert. I'm loving, you know, the isolation and the excuse, you know, for staying at home. So on a lighter note, I think, yeah, we have to look at the positives of all of these issues for the last 3 months.
Andre, anything else you'd like to add to that?
Yeah, I mean, it's this mixture between, so what's coming next as far as the virus goes, we of course have no idea. And thank you, Cece, for pointing out this like huge exhaustion that we're at, and we cannot go on any further. And yet we do know that more research is needed. We know that visibility is needed. I think we can see more protests on the horizon. And not just protests for LGBTI, but I think we're going to start seeing more protests to question fundamentally how our world order is set up. And I think as we do that, we have to work out how to be fierce citizens who are protective, not only of our own rights, but those of everybody on this planet. And I think, how are we good neighbors to the other communities, and maybe the new communities that we didn't even realize were marginalized? You know, domestic workers suddenly came up as a whole new, they've always had issues, but there's like a whole new category of facing marginalization during times of shutdown. You know, parents who have children suddenly having to homeschool children, like a new level of people who are facing challenges. Hopefully it's a time of what we all crave for, which is real deep empathy, to be able to say, I will stand with you. In ways that we've never done before. And so I am an idealist, but I think that's for a good reason, is because we get given moments like this, which are horrific moments, and we either take them and we try and run with them and say, we will do things differently. How can we be better allies? How can we be actually changing this world so it can be just a little bit better? I mean, that's why I do my job. And also where we got a few questions which came in, which we can also type responses for.
Sure, wonderful. So we've had a couple of questions come in here. Hold on, we'll go back. So there's some interest here. I see a question regarding Helen's mention of the apology issued by the Prime Minister Justin Trudeau in November 2017, which was raised also by Consul General McCormick in a brief presentation before the line cut off. Helen, could you just maybe talk a little bit about that in terms of you know, the advance and maybe what other countries can learn from that? Andre had made reference to 77 other countries ahead of the United States in terms of human rights progress. Maybe you could just speak briefly to that.
Sure. I mean, very briefly, our Prime Minister apologized to Canadians who were basically kicked out of the military, the civil service, and the RCMP, which is our national policing body, because of their identities. They experienced trauma, abuse, discrimination at the hands of the state. So it was through the Purge, it was called, and Egale put together the Just Society Committee to call on the Canadian government to enact a number of recommendations to address the Purge. And so, long story short, because I know we're running out of time here, our Prime Minister apologized for state-sponsored homophobia and transphobia to our community in 2017. And it was a very poignant moment for a number of reasons. The Prime Minister brought his children into the House of Commons. There were folks from the military who had lost their careers. Some had lost their lives, who would never be able to see this moment, were in attendance in the Parliament, and every member of the our House of Commons supported the apology. So it was a very, very significant moment for us and a turning point on many levels, but also there was an international dialogue in Delhi in December last year that was organized by a group called ARC International. I think Alga was involved in that as well. Egale was involved, where activists and lawyers from countries that had similar apologies to Canada came together to discuss how the movement could try and get their jurisdiction, their governments, their legislatures to enact similar apologies, and processes and ways in which those apologies can be drafted, and how we can lobby to get our governments to do that. So it was a very significant moment here in Canada, but it also allows us to participate in international dialogues, to share resources, to share promising practices. This may not be a best practice in other jurisdictions, but it's a promising practice in terms of how other countries and activists in other countries might push their governments to do similar and take on similar projects. So for us, it was huge. And I know that out of the ARC dialogue from Delhi, there will be a report, and I encourage folks to seek it out when it does come out later this year, to get the promising practices from around the world with respect to government apologies.
Helen, I hate to interrupt, but thank you so much. And the last time I was with Helen, it was, of course, was at the program we did at Southern Methodist University, but we also had a lot of fun the night before, having some fajitas and tacos at Mercado here in Dallas. So nice to see you again, and stay safe. And thank you all for being part of this conversation. Consul General, we lost you briefly, so I think it's only appropriate that you give some concluding words, and after that, I'll wish everyone a good afternoon.
Thanks so much. Yes, I was lost, but now I'm found, I think is the famous line. Thank you to everyone. It was really a great conversation, and obviously the first conversation that we've had here on this topic. I saw in the Q&A the question of allyship, and what I want to say is, as the government's representative here in the region to the South Central United States, we are really here to engage with the LGBTQ2S community. We are interested in figuring out how best to connect with everybody, and we're also thinking about how we engage with businesses, diversity businesses, and promoting trade linkages and connections with Canada as much as possible, getting involved in dialogue. So I just want to end with a message of openness about working with the LGBTQ2S community here, and that we are here to talk and to listen and engage. And I'd like to thank you, Jim, and your colleagues for helping us create this platform for this important discussion.
Our pleasure. Have a great afternoon, everyone. Thanks for being with us.
Thank you so much.